Hi, good afternoon, folks. It's Paul Gunson from the Ark. For those of you who know, my podcast now is using the analogy of the Ark, preparing for change. And as we now face a new world where we are being asked to change, certainly on a social level, and given this current COVID-19, we're very much aware of keeping safe, being safe with our family. And what I'm going to do today is I've got a guest, somebody who I've known for a couple of years now. In fact, this time last year we were in Las Vegas together. We spent 4 days together in taking a message out to pharmacy and to the health industry in general. And given the medical conditions that we're now facing, I want to introduce a dear friend of mine. He goes by the name of Coach Bud, and I'm going to let him explain that because it's quite a great story, I find. We're going to have a conversation about how people, particularly in the US now, because this is crossing the pond to the old Grand Tennessee, and I believe they're quite good at making whiskey, like our Scottish lads are over here. So yeah, so can I introduce Coach Bud? Bud, tell us a little bit about your story. Tell us about your coach position, and then we'll talk about your involvement in the company, which is ACG, which stands for Advocate Consulting Group, and then we'll have that conversation, my friend.
All right. Well, first of all, thank you so much. I'm honored to be here. Anything I can do to help you, I would always jump at. Yeah. So, Coach Bud, actually, I played college football 100 years ago, and had the benefit of being coached by 5 now former NFL coaches while I was at the University of Miami. We won a couple national championships while I was there. And so I not only the 5 head coaches that went on to the NFL, but also many other great coaches. Then when I got out, I started coaching myself. I coached a little football, high school football locally here for my son's team. But since then, I had transitioned over to coaching people on how to enrich their own lifestyle and improve the lives of other people. So that name just kind of stuck. It's been Coach Bud, and that's fine. I'll answer to just about anything.
Yeah, as I mentioned, we spent some time together in the US last year, and we were particularly at that time promoting something that is quite hard to say, and I think a lot of people find it hard to actually still say, which is pharmacogenomics. So I'm going to ask you, Bud, if you would, because I know as an executive member of the company, tell us a little bit about your role. Explain to the people who may watch this what pharmacogenomics is and what the company are aiming to do with that, particularly in relation to the number of deaths, because I know there's some statistics associated to this as to what causes the pharmaceutical industry to be, in a place that really does need to be focused on at the moment.
Yeah, so about a little over a year and a half ago, I was introduced to the genetics testing space, the industry. I was introduced to a cancer genetic testing program and also a pharmacogenomic testing program, which, by the way, and I admit it took me 30 days to learn how to say that. It's much simpler to say PGX and CGX for this and cancer. But so what happened is I got educated on the subject. And when you educate yourself on the subject of pharmacogenomics, you will be absolutely shocked. I believe you'll be blown away to know and realize that the number 4 cause of death, at least here in the United States, is adverse drug reactions due to properly prescribed legal medications.
Wow.
I'm not talking about heroin or methamphetamine or whatever. It's you go to your physician, you get a prescription, you go get it, you take it, and here's some of the stats. And I really believe these are on the low end, but over 100,000 people a year in the U.S. die from adverse drug reactions to properly prescribed medications. I just want to put that into perspective for your listeners, your viewers, is that works out to about 350 people each and every day that are dying from medications they're getting from their doctors. And I'm not saying medications are bad. What I'm saying is people are built differently. So, Paul, you and I could take the same exact drug, the same exact dose, the same exact time every day, and it could help you and it could kill me. It's not because the drug's bad. It's because my body metabolizes that drug differently based on my genetics than yours does. And so just put into perspective, 350 people a day. In the U.S., if a big plane, a jumbo jet carrying 350 people a day today crashed, it would be a huge news story. And then if another one crashed tomorrow and someplace else in the U.S., it'd be even bigger. If that happened every day for a week, I mean, literally the FAA would shut the aviation industry down until they could figure out what was going on. But yet that happens every single day in the U.S. in the medical industry. And about 2 million people or 5,000 people a day go to the hospital to be treated for adverse drug reactions. And I can see that. I understand that if you go back, 20, 30, 40, 50 years. But there was a huge study called the Human Genome Project that was done for 13 years, ended in 2003. So it's been 17 years, from 1990 to 2003. Scientists from all over the world got together and did this Human Genome Project. And since then, the information coming out to help the human race based on genetics is incredible. Continues to be medical breakthroughs each and every day around the world. But what they learned is that there is a direct correlation between how your human genetics, your biological makeup, metabolizes drugs. And like I said, we don't all metabolize the same. So when you hear a commercial for a drug that says they legally have to say, at least here in the US, we're one of the only few places in the world that actually let pharmaceutical companies advertise. But when you hear potential side effects, which they have to say, they list a whole host of side effects. Well, the only way you'll know if you get those side effects is if you take it, right? But if one of those side effects is death, that's not a good thing. So it's become more and more commonplace now. Unfortunately, even though the FDA in the US requires a PGX test on over 70 drugs before they're prescribed, still today in 2020, less than 10% of all providers in the US are even offering this as a service to their patients. It's mind-boggling. Having this information can truly save lives. And the science out now, and we literally, through Advocate Consulting Group, through our company, we have a program called the Exceptional Providers Program that has a suite of comprehensive services to help providers and healthcare facilities do many, many things, but improve patient outcomes is the primary one, right? So with that said, we have best-in-class offerings, and we have a very unique best-in-class offering for providers for the PGX testing. Are there other companies that do that? Yes, there are. Do they do it like we do? No, they don't. So I hope is that kind of where you want to be?
I mean, obviously from a company promoting that, yes. Let me just ask you before I kind of go a little bit deeper into that, what those programs are and what you're providing. Just give me a little bit of insight into how this COVID-19 is impacting on Tennessee, your hometown. I mean, have you seen a change? How is it affecting? How's it impact on? Have you got any personal experience within, maybe family where, as you know, I lost my wife 4 weeks ago to COVID-19. So, it personally impacted on my life and my family's life. So tell me a little bit what it's doing in Tennessee.
Well, Paul, let me address that first of all. Personal experience is really why we're here. I mean, again, when we started with the PGX offering, but again, we have a suite of offerings, and I know you have personal experience with adverse drug reactions. Many of your listeners and viewers will have those same experiences. Either you have a personal experience with something like adverse drug reactions, cancer, COVID, or you have family, friends, loved ones who have had a personal experience. So most of the advocates that work with our company literally are here and would help their loved ones, whether they got paid or not, because it's the right thing to do. I mean, it's the heart to help other people, right? So yes, COVID-19 has, and again, I have personal experiences in my family with adverse drug reactions and cancer, but COVID-19, I believe, has affected the entire world. It literally impacted our company in a huge way. And while we were leading with the Exceptional Providers Program and the analysis to see how we could help the provider, we have to respond to the marketplace. And right now, the marketplace is demanding COVID takes over everything. So whether it's the COVID test care, the testing kits, or personal protective equipment, PPE, or whatever, we even have I call it the COVID assault vehicle. We have like if you watch the movie Stripes and they had the EM350 urban assault vehicle, we have a vehicle that literally a mobile station that can seat bed 12 to 17 patients, and it's a full medical facility that's mobile, just geared towards COVID. So there's a lot of things that we're doing in response to, and telehealth is a huge one now, because again, most providers are canceling or rescheduling non-essential appointments for their patients. So it's a huge thing, just like we're doing now with Zoom. A lot of doctors are now doing their visits primarily through telehealth, and we have a phenomenal HIPAA compliant program. But COVID, personally in our town, we have, I believe my mom possibly had it. I believe my mother-in-law possibly had it. And this was, a little bit ago. My mom did get tested, and I think she tested negative, but I think it was after it already gone through. And she did one of those really hard nasal swabs to the back of your throat and had it sent away and got notified in 5 days. We now have a 5-minute point of care test that will give you results, but it will also tell you not do you have it, but have you had it? So it's amazing the progress they've made in such a short amount of time. But in our own town, we've got several people. A good friend of one of my daughters used to come over all the time. Her dad has it. He's just recovered from it. He's had it for about 2 weeks, and he's just recovered from it. Praise God. So yes, it's impacted every part of society. We've got stay-at-home orders here. We literally can't go out unless we're going to the grocery store or the drugstore or the pharmacy or the doctor's appointments. And that's in place at least till the end of April for us. So it's changed every part of life for most people.
Okay. So given the fact that obviously there's a lot of news media at the moment, Bud, and the UK is no different as it is over in the US. But are you hearing anything that's kind of, I'm not saying conspiracy theory side of things, but are you getting anything that's coming through news from people, where, give an example. My granddaughter works as an ODP, which is an operation department practitioner in the theatres. And, we've got our government saying everyone's got a PPE, everyone's got this, everyone's got that. But she's frontline and she's telling me, no, we haven't got the supplies. Her face is breaking down, her skin's breaking down because she's got this mask on all the time. And there are so many nurses and doctors who it's impacting on now. Have you got any sort of insight stories of anything that you've heard, or, people who are advocates as part of our team? Are they telling any stories? Because I know we do a Zoom cast each week. Are you getting anything that's coming through that's not in the media?
Not in detail, in depth. There's a lot I hear from conspiracy theory people that this was started by governments and for purposes. And I've even heard the Bill Gates conspiracy. He started it for vaccine. And again, I wouldn't put anything past anybody, because I don't believe that any government shares all of the information that they know with all of their citizens. I just don't. I don't know that we could handle it if we knew the absolute truth. But we do have a lot of healthcare providers that are advocates for our company. My daughter also is on the front line. She works at a hospital, and she's still there. And again, they're just trying to flatten that curve right now until they have a better handle on it, to try to, especially protect the people that are really susceptible, the elderly people that, the death rate is so high in because their immune system's compromised, those people that do have compromised immune system. So it's really just, try to, stay at home and stay safe until they figure out how to better handle it. And I think it's making a big impact here. Again, it looks like it's crippling our economy here and around the world, and that's a challenge too, because there's a lot of things that can cause health issues. One of them is stress, can literally cause physical health issues. There's been many studies to prove that. So yeah, there's a lot going on. So we just try to stay positive and support each other. In fact, one of the things our company does, Paul, is we instituted a Saturday support session. So we do a webinar on Saturdays, not just for our members, but for anyone they want to invite, friends, family members. And we really don't talk about our company. We talk about tips, strategies, inspirational ways to not only survive, but thrive in these trying times that we have. And we post those on the website for our members to go and listen to if they couldn't attend live. But, there's enough negativity out there in the world, especially if you turn on the news. And a lot of the news stations know that in order to get viewers, they have to be sensationalized and overdramatic. And again, I'm sure there's political agendas behind a bunch of that stuff. But again, and this was even before COVID, there's enough negative information out there in the world anyways. So we have a tab on our website called PIPO, which is positive in, positive out. And that's what we always want to share with our members, positive information in. And I believe it has an impact. Let me give you a personal story about COVID. So my mom, for sure, my sister called me from New York a few weeks ago and said, your mom thinks she's got corona. And I said, okay. My mom lives across the street from me. And so she was really sick. I'm telling you, she was sick for like 2 weeks and couldn't breathe and couldn't sleep and had challenges. Well, I didn't think she had it, but I thought she had the flu or pneumonia or something. So anyways, she got to a point where she was willing to go to the doctor. She doesn't like to go, but we took her to the local clinic in town. And I took her there hoping, praying that they were going to, diagnose her with flu or pneumonia so that she could get out of her head mentally that she had COVID, because she just watches the news all the time. She watches, in my estimation, the wrong channels, the one that sensationalize it and create fear. And, so anyways, we went there and she was there 45 minutes and he wanted to send her to the hospital by ambulance. He did let me take her to the hospital, but he said it's not pneumonia and it's not flu. So we went to the hospital. We were in the ER for 6 hours. I had to go into a special waiting room, had to wear all the gear and stuff. And they gave her a respiratory panel that ruled out 17 other respiratory issues. So they would not give her a COVID test then. They said they didn't have them. And so they said, leaving there, it was either a really bad cold or bronchitis, which they can't diagnose because there's no test to say, yes, it's bronchitis, or it was possibly COVID. Well, in the 6 hours that I had my mom locked in the waiting room, captive with me, I shared some of the other side of the story, some of the positive information, some of the things out there that the media wasn't sharing with her because she wasn't getting that from what she was watching. And literally within a few hours, she said, so you think this is all in my mind that I have this? I said, no, Mom, I'm not saying that. I don't know. I'm just saying it's possible that you don't have it. And literally, we watched a couple TV programs that had nothing to do with the news and all that conversation. She walked out of that hospital 6 hours later. It was after midnight, and she knew in her mind she did not have it. And I, on the other hand, which I didn't tell her, thought, oh my goodness, she may have it, So it backfired on me. But they did prescribe her a Z-Pak, zithromycin, to treat if it was potentially bronchitis. And literally, I don't know if it was a Zithromax or her mindset, but literally within 2 days, she was walking around the neighborhood for an hour and had no coughs it was amazing. Praise God. So.
That's really good, but it reminded me of a post that I saw on social media yesterday. It was a woman goes to her doctor and says, Doctor, what's going on? I've got anxiety. He says, look, you're a hypochondriac. And her response was, oh, don't tell me I've got that as well. So yeah, that's obviously making very light-hearted of what is a very serious issue right now.
Oh yeah.
But here's the thing, I mean, as I've already said, we've known each other for a couple of years. I know that we've worked together in the cryptocurrency space, and there's lots of things going on in the world today. What I'd like you to do from your executive position within the company, just so that we can help promote what you're doing over in the USA and what I'm doing, because I'm part of the company as well, is just explain, your role, and just give people what they can practically do. We talked about pharmacogenomics, how simple a test that is for their pharmacy advocacy part, but what you're doing as a whole company, because I know you're really developing some tremendous work out there. But just kind of give yourself a shout as to what the company is doing, what it's offering, and what maybe other people who may be losing their jobs, may be looking for an opportunity here. What would your message be to those people who might be looking for an opportunity?
Okay, well, my role, my official title with Advocate Consulting Group is the COO. But again, my role is the coach. I'm the coach. I'm the one who, I believe that, we do not require a medical or healthcare background to be affiliated with us. I believe that the people that will do the best with our company are the people who have a heart to help and serve others. And that's teachers and coaches and preachers and social workers. Yes, we have a ton of people in the healthcare space that are working with us, but we also have a lot of people. I have no medical background at all, so thank goodness I wouldn't be able to join our company, because some companies will require that you have experience. But so as a consultant with us, and I'll say a representative with Advocate Consulting Group, like I say, my role is to make sure that you know what to do, how to do it. You have the tools, information available at your fingertips 24 hours a day so that you can be successful in our company. And our advocates have actually the ability to wear 3 different hats as a representative. First is as a medical services consultant. And when I say that, again, initially we had the vision, but we launched with CGX. And then CGX had some challenges. That's hereditary cancer screening. CGX had some challenges. So we transitioned over to PGX. But again, our goal from day one was to have a full suite of services that could help the providers and the facilities out there. So as an advocate with us, number one, your role is a medical services consultant. And understand, you're not a salesperson. You're not a marketer. You're an educator. We educate people. Our goal is to educate people and providers about the benefits of personalized medicine through our program, through the Exceptional Providers Program. And there's many ways that we can help them. So your goal is not to go in and sell. Your goal is to just educate. And here's the neat thing about working from home, Paul, because when we teach and on the websites, the coaching website that we have, I'll give you an example, how to approach a provider. Well, there's multiple ways to approach a provider. Some of our advocates, even prior to COVID, would approach a provider by making a phone call and sending emails. And they'd send emails back and forth, and they would enroll the provider via email, via computer, without ever going into the practice. Another way is to, set up an appointment to go in, set up a luncheon, whatever. Those today, are almost impossible because the providers don't want you there. And who wants to go to a healthcare practice right now, right? If you don't need to be there. So the great thing is, those that do, and I'm one that enjoys face-to-face. I enjoy sitting down with the providers, letting them eat while I have their captive attention, spending, sharing 15, 20 minutes worth of information with them, and then, enrolling them. I mean, it's not challenging there when you have the tools and resources, but I'm learning to adapt to the phone and the email method, and it's it works just as well, and some cases better, because it's hard sometimes to get the FaceTime with the providers. But now a lot of them, because they've canceled so many appointments, they have some more free time to answer their emails and respond and reply and watch a short video here, or read look at a flyer here or something on that, an educational flyer. So that's one thing. The other option you have is to become a personal healthcare advocate. So that's how most of us start, Paul. You know, that is the first people. Once you understand what you have a hold of and how these can benefit you, not only will you want to get these tests done, like a PGX test and that, but you'll want everyone that you know and care about to at least have that same information. So as educators, you know, we go out and share, you know, first person I took to I go to all my doctor's appointments with my dad and my mom. Anyways, I always have. They're my only mom and dad. I'm their advocate, and I go with them anyways. Well, the first provider that we signed up was my dad's personal, was my personal provider, and then the second one was my dad's. But again, and I didn't care if I made money off my dad getting the test. I just wanted his doctor to have the most valuable information that they could have so they could treat my dad the best to keep him from being sick or dying because of whatever. So we can educate. Now, here's the great news in both of those things, and even in the third way. You do not have to be the expert, okay? You don't have to know it all. I was terrified when I got into this field, Paul, because I didn't think I'd ever be able to get an audience with a provider. And if I did, I thought, how could I teach a provider anything, right? Who am I to talk to a doctor who's got 12, 13 years of schooling and all this stuff, you know? And I was terrified. I didn't think I could. Now I can do it, and I can teach anyone else how to do it. It's very simple. And I got to tell you, that first appointment I had, my bodily functions reversed. My mouth was dry. My hands were sweaty. You know, it is like, I was terrified. I'm sure I didn't know what to say, and I didn't say it properly. But what came across was the passion that I had for my dad, you know, when I did that first meeting. The other one was a friend of mine personally, my own, so that was no big deal. But you don't have to be the expert. We have tools, like for the providers, we have websites that you can send them to so they can learn. We have videos, we have email templates, that we have scripts that word for word that you can call up and read the script and then send an email, cut and paste the email and put your own information in it, you know, contact. So we have all those tools in place, and we have websites. So for pharmacogenomics, you don't have to know what that is. You don't even have to know how to say it. But if you can send somebody to a website, whypgx.com, whypgx.com, that's one of our tools that explains what pharmacogenomics is. And it's not explained by me because I'm not the expert. It's explained by the Mayo Clinic. It's explained by, top providers in the country about why they're doing it. It has testimonies from other people just like me to share their story and their testimony with it. It has all the answers to any questions you would have relating to it. So again, you don't have to be the expert. You just have to follow the systems and the processes in place. And then again, the third way, which right now we're seeing big spikes, okay? Right now, the third way is you have the option to become a professional recruiter, if you will, as far as, you know, you have the option to build a team within the company. So we are not a network marketing company. Medicare, who we deal with here in the States, does not want anything to do with that. We've structured our program differently, but we do, just like most, you know, Fortune 500 companies have a employee referral incentive program. We have something similar to that. So we do. And again, our CEO, who's my partner, has been with several medical companies. He's helped take the last two he was with well over $100 million before they were sold. And the last company he was with, they spent $100,000 a year on ZipRecruiter looking for the right people, right? Going through a lot to find the right people. Well, listen, the core people we have, Paul, people like you, people like myself, people like, you know, some people you know that are part of this company that you've got to spend time with, you know, the Mark Schulmans. I mean, these are the right people. And we believe that they know the right people. And I would much rather pay you as an ACG rep to bring me somebody you know has the qualities that we're looking for, that you know, trust, you know, their integrity, their character, their ethics. They're going to be professional. They're going to be kind, respectful, polite, and thorough. Those are the kind of people we're looking for. I don't want a salesperson, because we're not selling anything. We're educating, right? And I don't want somebody who's only here for the money. And I don't want, you know, again, the money is huge in the health insurance and the health care industry. There's huge potential for income. But again, we want you here for the right reason. So there's different hats you can wear, and sometimes you'll wear all three at different times, or you can just focus on, being that medical services consultant and go out and help him. Our mission statement, Paul, is to make a positive and profound impact on the lives of others. And we do that through our Exceptional Providers Program.
Well, that's absolutely incredible. Well, first of all, thank you very much for taking the time to come on board and to do this on not only behalf of me as a friend and as a member of the team, but also for the wonderful gift that you've brought to the US. There are 358 million people who are probably going to need at some point to get this COVID-19 test alone, forget anything else. So, yeah, thanks for coming on board, Bud. What we will do, I'm going to ask people to obviously subscribe to this channel. We will be posting some additional information on our Facebook and along with our YouTube stuff. So anybody that wants to get involved, as you know, I will be happily to promote this stuff as well. And I'm just grateful for our friendship, and I'm grateful for what you're doing and everything that you're doing for the people of America. So, Bud, thank you very much. And for all those who listen to this, welcome to the ARC, and get on board and help save lives.
Paul, if you have time, and if you don't, that's okay, but I just wanted to share one of what I believe is the most valuable benefits of this business, or this type of business. It has nothing to do with the money, okay? Ultimately, we're in the people business, right? Yeah. And the number one benefit in our comp plan is the relationships that you're going to build through this company, through this type of company. You and I met probably 4 years ago. We actually spent time on webinars for, I think, over a year and a half before we actually ever met in person. Absolutely. And when we met in person, it was a family reunion, right? Absolutely. And we have worked together since that company with other companies, but whether we ever work together or not, Paul, you will be a dear friend of mine for life. I have, it's one of the relationships I value most. And when you're working together with like-minded people, goal-oriented people who really have a heart to help others, you create a bond that you can't create at a job. You know what I mean? So anyways, just blessed to be a friend with you more than anything, and thrilled to be in business with you for sure.
Me too, Bud. And yeah, it was great meeting you. We actually joked that we actually both have a pair of legs as well, which was interesting. But yeah, once again, Bud, thanks very much for getting on board and doing this. And looking forward. In fact, we should have actually been together next week, because I was planning to come over to do that conference again, but unfortunately we can't travel. So keep up the good work, and God bless, and keep going. But more importantly, stay at home, stay safe, save lives.
Same to you.
All from the ARC signing off. Thank you, guys. Thank you, everybody. Bye.
Bye-bye.